Yo yo, what's going on? Um, yeah, back 2 in a row. Let's go. Today I'm going to be talking about a topic, a topic, topic of discussion. Um, I'm actually going to dive into a story that I wrote for Illinois Latino News. It's a paper that I'm a contributor for. Um, and this is just the first topic because it's something I know a little bit about, and also some people told me, uh, got a lot of positive feedback on it, but some people had a difficult time understanding it because it does have to do with a lot of Illinois policy, Illinois state policy. So just wanted to I'll put the link to the article in the description. So I'm not going to go into too much detail about it. You can read it first before you watch this video if you want a little bit more of a deep dive into kind of what my thought process was with the story. Um, and my editor Hugo and I, we had Hugo Balta. He's awesome. We talked about well, first of all, the name of the story is "Complicating the Narrative on Healthcare for Undocumented Immigrants." And complicating the narrative is actually a term that's been used in journalism quite a lot. I wouldn't say a lot, but it has notoriety. And the idea behind complicating the narrative, or the CTN strategy, that's really what we're doing with this story. We're saying we're using this CTN strategy when we're talking about undocumented immigrants and their health care. And what the CTN strategy is complicating the narrative. So it's based on this idea that a lot of the narratives that we have about, you know, people who we disagree with are kind of straw man narratives, or at least in need of more of a deeper understanding, and trying to represent different ideas with a deeper understanding than we often see in mainstream media. And I actually don't think that mainstream media always tries to disregard perspectives, but the theory is more that actually, in order to really understand a perspective that you're not used to, or that isn't necessarily your own, um, it takes a lot of work to really understand it. And you kind of have to get to a point where you have to genuinely almost be questioning your own perspective on an issue. That's how far you have to go within these other ideas, because you're trying to see it through the lens of somebody else. And then trying to represent that perspective within this piece of journalism in the way that that individual or people promoting that perspective would want it to be incorporated. So it's a story about healthcare. It's about chronic illness, and there's a big focus on Latino immigrants, undocumented immigrants, because the story focuses on a specific Pritzker policy, the stopping of extension of healthcare. So if you're an undocumented immigrant, 42 years and older, from 2020 during the pandemic up until July 2023, you got a certain amount of healthcare coverage, which was connected to federal funding because of COVID. But that has stopped, and the reason is because there isn't enough federal funding. It's costing the state exorbitant amounts of money, and it wasn't really meant to be a long-term strategy. But you have people like Healthy Illinois, who I talk about in this story. She's kind of the pushback to that idea. You know, Healthy Illinois is an organization that advocates for universal health care and expansion for all undocumented immigrants. And their perspective is, well, they saw it as an opportunity, really, to be to introduce a way to begin the campaign for universal health care, really. So, of course, they're against Pritzker stopping it. And ultimately, it's at the end of the day, this is kind of your stereotypical left versus right healthcare debate. The aspect that is interesting is when our source, Dr. Kuba, comes in. She's a professor at Loyola Chicago University. And she talks about how early on in her career, she worked at a few different big name hospitals. And she kind of began to realize that a lot of money within healthcare goes towards treating chronic conditions. Chronic conditions, diabetes, health, cancer, heart disease, liver disease. The list goes on. I don't have the list in front of me. I'm forgetting the rest of it. But it's a very prevalent thing. 90% of all healthcare expenditures in the United States go towards treating chronic illness. 7 out of 10 deaths every year are due to chronic illness. And so what Dr. Kuba realized is that there isn't really a lot of focus on preventing this. And really the whole article kind of comes together at the end, and which is kind of my point. Because according to the Partnership to Fight Chronic Disease, the current economic cost of chronic illness is $1.6 trillion per year, but is trending towards ballooning to $6 trillion a year by 2050. So what Dr. Kuba realized early on in her career, this idea that we don't spend a lot of time trying to prevent these diseases, it's kind of an open question. Well, is there an incentive to do so within the healthcare industry? That $1.6 trillion is being made by healthcare, by the healthcare industry, right? And that $6 trillion will be made per year by 2050, be made by the healthcare industry. So the question, I'm not insinuating, but there's a question, an open-ended question of maybe consciously, maybe subconsciously, there isn't enough funding driven towards preventing chronic illness. And that is the reason why the United States is, well, we are by far the worst off in terms of chronic illness and health on so many different levels. So, I mean, it's hard to deep dive. There's a lot of aspects to this story. But ultimately, that's really what it's the first part of a series of a few different stories that we're working on. And I just kind of wanted to lay down this idea that we have these debates all the time over, everybody should get health care, or, it should be privatized, and, so eventually it gets cheaper, and yada, yada, yada. But we kind of have that conversation in a vacuum, right? Because most of that conversation is only dealing with treating issues that already exist. We don't have a lot of discussions, at least policy discussions, about preventing what could be coming. That just simply talking about the health of Americans. Americans are unhealthy, very unhealthy, and we just don't have conversations about why that is the case. And I think that, well, I'm not going to insinuate, but there isn't the biggest incentive from our healthcare industry to focus on that conversation. So it might be awfully convenient for them that we don't talk about that. And we just argue. We argue about expanding access, limiting access to treatment. But we don't talk about our health. We don't talk about how healthy you and I are, our neighbors, and then in comparison with the rest of the world. And I think that opens up a pretty big book. And the next story